So once again, I welcome all of you to the EdTech Lounge on behalf of the Network of Quality Teaching and Learning. I'm very happy to see all of you here for today's session. If you are attending EdTech Lounge for the first time, let me just introduce the lounge to you. This is a community of practice that we have established for faculty members of higher education, to learn from each other about teaching and learning with technology, particularly in this context of COVID-19, to share experiences and to learn from each other about online teaching and learning. The format is very simple. Our expert will speak for about 15 to 20 minutes, and after the talk, we will open the session for question and answer. During the talk, if you have any questions or comments, please use the chat window, and we will address all the questions at the end. If you are facing any technical issues, please mention in the chat window and one of us will try to help you. Please keep your video and your microphone turned off during the presentation to preserve bandwidth. I would also like to request you to not take any screenshots or record this session without the permission of the presenter or and all the participants of the session. Okay, so with this, let me introduce our today's presenter. I'm very happy to introduce Khairulnissa Ajani, Assistant Professor and Assistant Dean, Teaching, Learning and Undergraduate Programs at the School of Nursing and Midwifery, Pakistan. Khairulnissa Ajani is currently providing support for the delivery of academic programs at the undergraduate level at Sonam, Pakistan. Since 1997, she has been working with Sonam in various administrative positions and has gained a vast experience of working with all the academic programs. In addition, she has served in medical, surgical, and emergency rooms at the Afan Hospital before starting her career as an educator. She has studied masters in nursing with the distinction in thesis and is currently enrolled in doctoral studies in nursing at the Afan University. Her area of interest and work is around education and curriculum development. She works closely with the Network of Teaching and Learning, regulatory bodies of Pakistan Nursing Council and Higher Education Commission to bring about changes and innovation in the curriculum at the entity and national level. She is involved in teaching the education specialty track in the MSCN program. She serves as a supervisor for master studies, and she has a number of publications in national and international journals and has been invited as a speaker at national forums. So we're very happy to have Khairulnissa Ajani here to share with us her and School of Nursing's experience of including all the students in the educational process during the pandemic. Over to you, Khairulnissa.
Thank you very much, Azra and Tashmeen and the QTL office for giving me this opportunity to share my story, I would say, and my journey as the head of teaching learning along with my team, so that this could be shared across and I could get good recommendations and share my learning and my experiences with the team across board. So thank you very much, and I will just take a few seconds to share my screen with you as I begin. Okay, so I am going to talk for the next 15 minutes on how the journey started with COVID outbreak regarding our students and how School of Nursing and Midwifery Pakistan process during the lockdown and during the COVID, and what our experiences were. I will begin with a little introduction of what we do normally. I will take you through the process and journey of how we went into each step of planning, of including these students, especially in the north of Pakistan. And then amid those planning issues, what were the experiences or what were the interventions that worked well, what did not work out, how we had to change our plans, and how we had to face the challenges. And I'll take you to the process to update you to date as to what has been done and what is being entailed and how it has been planned. So before I start out with the formal presentation and take you to the journey, I would really like to acknowledge my very dynamic team of my academic leads who lead the program, and of course the leadership of the School of Nursing, the leadership of AKU, our dean, the other assistant deans who look at the clinical practice and the research initiatives, the academic leads of the program, the curriculum chairs, the support staff, everybody who directly, indirectly has been a part of this journey and are still working very hard to reach the students, to offer them the best quality program and education that we promised them as a university. So to begin with, School of Nursing and Midwifery in Pakistan, just a general outlook for people who may not know what the school entails. We have 3 undergraduate programs. We have a 4-year BSCN program, which is offered to the school leavers, the high school leavers with a science background, and this is the first stepping undergraduate degree that they attain in the profession of nursing. And then they become nursing interns and registered nurses, and they get the license to practice in the healthcare system. The other 2 programs are post-RN BSCN and post-RN BSCM, offered to nurses who had done their 3 years diploma, which was the previous mode of entry into nursing before the BSCN set in. And after the 3 years diploma, they had to attain at least 2 years of working experience. And then this was the first bachelor's degree for them, but they are already practicing nurses. So BSCN group becomes a pre-service, and post-RN and midwifery, post-RN BSCN is for general nursing, and BSCM is the bachelor's in midwifery specialty to the already practicing nurses. So they kind of become intra-service compared to the school leavers. Then we also have a master's in nursing program, which offers the graduate degree to these undergrad alumni and undergrad staff and other people who, other nurses who are working outside AKU as well. And they are giving the option of taking a specialty in education or clinical as their interest would help. And then we do have a nursing stream in the PhD program. The PhD at AKU is of health sciences, and then we have specialty streams from departments. So nursing PhD stream is the one that belongs to School of Nursing. The total student strength that we have, excluding the PhD, is a total of 625 students. So when the COVID pandemic struck in and the lockdown came in, we went through an assessment mode of finding out which of our students have access to internet that can be used for educational purposes. Besides the social purposes, or besides having access to just WhatsApp phone call as an example, we went out to assess how many of our students were able to have an access to a quality internet that would give them the bandwidth to have educational, meaningful interaction with the school. And with that assessment, we found out that exactly 43.2% of our students did not have access to internet that could give them comfort of an educational exchange. So moving on, some facts that I would like to bring to this context to have you all on the same wavelength would be that as a norm, School of Nursing and Midwifery functions on a blended learning mode. So starting with the post-RN BSCN program as the first one to begin in around 2012, followed by the 4-year undergraduate BSCN program starting 2 years ago. All the undergrad programs follow the blended learning mode pre-COVID as well. So all our faculty members are trained and they have the skills and the capacity to run the curriculum on a blended learning mode, which was the normal mode of operation for us pre-COVID. And so the capacity, the training, and the confidence of working with students online, especially on the blended learning mode, was the strength that we possessed as, we do possess still as a faculty of School of Nursing. Around 60% of our students come in from northern Pakistan and few are from the interior side as well. And looking at the, and in line with the mission and vision of the university, that we offer curriculum and training to people to in commission semester system. So we have 2 semesters in as a part of our normal academic calendar. So safe and sound in terms of health, in terms of exposure to the disease. And so we directed them to vacate the hostel and go back homes. And we made sure that, you know, their transport and everything was taken care of at the university level to ensure as much of safety as possible. Again, as per the rules of the Higher Education Commission, the academic calendar and the semester dates were arranged in a manner to accommodate a pre-born summer break. Like the secular education around the city also gave kids some summer vacation ahead of time so that they could be out of the school premises and the traffic would be controlled. So we had to follow the same thing, and our semester was put on hold, and we were on hold after the 10th week of our semester, and we remained with the 7 weeks of teaching. So our students were given summer break that time. And then as the COVID spread more and the extensions were given, we had to follow the same guidelines, and our 9-week break was then extended to an 11-week break. And then when HEC allowed us and everybody else to start teaching online, we started preparing to teach them online. And now the irony was that our faculty was prepared, the resources with the faculty was there, the capacity was there, and we were trained, and we were the only entity then who was completely ready to start online teaching. But because our students are from the areas where internet and technology does not prevail so well, so we had to face challenges in order to lay out the whole plan for our curriculum to be offered in a way that would safely reach all the students with the same quality. So what did we do first? As a first step, we had to assure the students that now that HEC has allowed the studies to begin in the online mode, and all the other schools, secular, academic, professional, everybody was going around starting their curriculum, there was a wave of anxiety, expectedly so, amongst our students as well. So people started calling up that how are we going to study? We do not have internet, and how are we going to manage this? So before all this could be put into place, we started making calls to our students to offer them moral support, to relieve their anxiety, to tell them that we are going to plan things in a manner that nobody is left, and just because they live in an underprivileged area does not mean that they will be deprived of education or they will be deprived of quality. So we started working on a model that where we normally have this model that we have a faculty mentor or an advisor assigned to a group of 15 students. So with the help of the academic leads and the program coordinators, the faculty started to make calls to these students, get them into WhatsApp groups and messages through class representatives, snowballing by, if you live nearby to a village where there is no phone, can you just send a message to X student that, we will make sure something is arranged for them. And that kind of moral support and assurance was offered through a lot of our coordinators, our faculty, and our program leads, making these calls to the students so that we could assure them that things will be done on an equity basis, and people who are deprived will not be deprived of whatever we offer. We regularly sent notes of updates and moral support from the Assistant Dean's Office and the Dean's Office as well. And as far as we could reach on WhatsApp and MS Teams, we had town halls with the Dean where we encouraged these students to take our messages to across villages where people were there and they knew through some relative support, through some friend support or whatever circle they could. And through all these combined efforts, we were able to make contact with all of our students one way or the other. So we knew exactly each of our students were and how we could contact each of them, even if they did not have internet access, through phone calls or through snowball through the classmates. We were able to reach all of them. So 625 students and all of our faculty, you can imagine the effort each one of them made in order to get in touch with all the students to ensure their safety and to offer the moral support that we could as a faculty advisor. So we did a baseline assessment, like I said earlier, that if they have internet or they do not have internet, then we started to list these data into table format, which was able to give us the exact number of people with their contact numbers and with their exact locations, that they live in X village or Y village and they have access or they do not have access, and what is the number of the students that we would have to plan at what level to be able to allow them to get access to the education. And then we had to prioritize in terms of the finance, in terms of student safety, in terms of transport, and in terms of quality as to what was the best available route. So we started working on this hub and spoke model. So what we had already tested, that we have one faculty member as a facilitator looking at a group of other students and reaching them out into smaller groups. We took the same hub and spoke model where we said that we at Stadium Road campus will work as a central body, and we will connect through AKDN, because we all become a part, we are all a part of AKDN, and we will use this opportunity to liaise with the Aga Khan Education Services, use their satellite schools and centers and offices, which are very well spread out in the north of Pakistan, and then see if somewhere we could connect our students to these satellite schools, and if they could use the computer labs and they could use the internet available in those schools to make an educational contact. With this, Aga Khan Health Services was also an option, but that did not come into a viable option because that was being used for COVID patients, that was being used for quarantine for their own staff. And so it was not a safe model that we used the same premises which was used for the health issues for our students to limit exposure. So that's how health services was not an option. So we then went on to the Aga Khan Education Services to liaise as to if this could be done very safely amongst the other options. So with this, we started collaboration between AKU and Aga Khan Education Services leadership. Of course, this was done from the provost, the president, and the vice provost offices. where the leadership had an understanding, and where the terms were sorted out as to how many schools could be opened, what will be the finance that will be used, what will be the human resource that will be used. And thanks to the leadership, that when this was sorted out, we placed a liaison person, the provost office placed a liaison person in Gilgit-Baltistan in Chitral, where we could exchange notes, because somebody had to be there at the grassroots, at the ground level, to enable us to understand the exact situation, make better contact with our students, and make better contact with the education services, so that we could model and tailor our interventions and planning in a way that suited best to the benefit of our students. So we started putting, with the help of this liaison person, we started putting our students into small clusters. Clusters according to the areas that they were placed in, across board, all years, all program. So area-wise clusters, and then these clusters were assigned to the nearest possible travel route AKES center, where our students could walk to or travel to with all the safety in place, and then utilize the services. Then we started informing the student that you belong to cluster A and you will have to travel to school A and meet X person and open the lab, and then start working in the computer lab, and take your laptops if you have, so that you are in the campus where there is Wi-Fi, and then you start working and logging into your VLE support. So because it had already taken 3 months, the first thing that we faced as a challenge was that when the students started to log into VLE, they realized that because they had not logged in for 3 months, their passwords were expired. So we put in a helpline system from the entity, from School of Nursing, where our blended learning team officers were given dedicated telephone numbers and telephones, where students could drop messages through each other, so that their VLE passwords were revived and they could then go back and access it through the schools. So this is how the whole roadmap of the student reaching an educational center for where there was Wi-Fi and they could connect. Meanwhile, the Vice Provost Office also did a detailed assessment of the access of hardware to the students. How many of them have laptops? How many do not have laptops? What is the memory of the laptops? And so likewise, the ICT lab of those schools of AKES had to be made functional, so that people who did not have their laptops could use the computers along with the Wi-Fi for these centers. So now you can imagine the planning from here and the planning at the end of GBC, where those school staff had to be called in, had to be paid for, had to be made available with all safety measures, so that these facilities could be cleaned, made available for our students to come in safely and log into their VLE for educational contact. So along with the process, of course, we had to make a lot of changes at the curriculum level as well. So at the course level, the first step that we did was that we highlighted the must-know of the courses. So what did each course entail that had the must-know component that had to reach the student one way or the other? Because see, we are talking about healthcare system. We are talking about patient care. We are talking about treating diseases and helping people recover to better quality of life. With healthcare, there cannot be any jokes, or there cannot be any midway of not being able to be competent in their skills as nurses. So that must know was designed in the best way, in the best strategy and the best assessment strategy in order to suit the situation. So we knew that they do not have internet. We knew after they started going to schools what level of internet they have, and what strategies would suit the curriculum best, and how we are going to make sure that the must know reaches them, and how they could be assessed by remote or VLE learning so that we could declare them passed to be able to move to the other level of the semester. Faculty preparation and capacity building was another parallel activity that was going on. So with the QTL net, we had an intense workshop planned where the faculty was prepared to apply and build guidelines for assessment strategy with low bandwidth internet for these students. There is a must-know component in healthcare where the nurses and the physicians have to do hands-on clinical hours. There is no alternate for that. So we decided that we will carry forward the hands-on clinical hours credit to the next semester when we expect things to become better, and whenever it is safe for the students to come back. So we hold on for those credit hours which are must know in terms of the psychomotor domain, and we finish the must know of the knowledge piece in the online manner. We also worked around with the CIME Center of Innovation Medical Education in our university, where we strengthened the simulation strategies so that before the students could go into the clinical, their hands-on safety was ensured through the simulation strategies. And to get the quality indicators and the best practices in order, the approvals for the curriculum committee was also sought at the departmental level and the registrar working group level, so that there was no compromise in quality and the best practices were ensured at all levels. So it was a night and day task for the curriculum committee as well to look at all around 40-45 courses in a go, so that their revised assessment and the revised strategies could be approved and then implemented for these students. So some of the challenges I have been sharing as I was talking with this journey. So the first and the foremost was that maintaining quality measures, best practices, which our curriculum committee ensured and which the course leads ensured and the academic leads ensured, and it was checked at all levels that we are not compromising anything, but in the best suitable manner these issues were tackled and the teaching material would reach the students. There was frustration amongst the student, there was frustration amongst the faculty member with concept of equity, with principle of equity. There were so many students who waited very patiently for their classmates to get access to the internet because they were right in the middle of the city. They had all the access that they wanted, but sometimes they got frustrated. Sometimes they realized with patience that, but the principle at the School of Nursing was that till all the students gain access through the internet, the online teaching will not begin, because we did not want any of our students to feel that because they lived in an underprivileged area, they are being deprived of education. Once the students started to go to the education school, rain hit. There was weather conditions that did not allow good speed of internet. So there, as an example, there were 10 students sitting in one school ICT lab, and all of them started to download and none of them could download, and they realized that the internet speed is at a level where only 1 to 2 people will be able to download, and then they will have to copy it amongst their own USB, because all of them could not use the internet access at one go. Student safety and transport was another issue which the leadership was able to provide to the student. So if they had transport issues, if they had to travel long and it was costing them money which they could not afford, the facility of getting that transport budget was also offered to the student by the university. Maintaining the SOPs, wearing masks, use of sanitizer, social distancing was maintained at all levels, and people, our students would send us pictures, which was shared in the Ed Lounge last week by our colleague Mehtab as well, and we would remind them from here on WhatsApp, please do not sit close to each other, you're wearing a mask, and we had class reps elected there in those small groups who would make sure that the mask was on and the sanitizer was being used and hand washing was being done and the distancing was being maintained. Student interaction with the school staff. Some of the AKES school, when people in the village saw that the school had opened, the teachers felt that this is a very good opportunity for us to go to our school and start preparing for our teaching plans when, when their students would come in. So again, there was more traffic, there was sharing of the internet, and then negotiations had to be made that, this is only for AKU students for so and so week and so hours. So if you want to come, you come at a later date. We ended up making schedules for the students for traffic control and equal sharing of resources that, at one day, one point in time, one day, half day of the week, a particular year is going to go, and then that the other day, the other school is not going to go and some other year is going to come. So our academic leads then put together a schedule that the students had to follow. And the good thing was that because we were on the VLE and we were not doing any synchronous teaching to start with, our students would come in, download stuff, go back and study home, so they need not come every day, which would ensure the safety also in terms of health and transport as well. So all these challenges we had to do as we took each baby step, and we found out that this was working and this was not working, and we quickly had to adjust our schedules and timings and routines in order to meet the needs of these challenges. So before I end, the current situation is that out of 270 students that we started off with, 60 students do not have internet access to date because they live very far from any possible AKES satellite school also. So we are now in the middle of distributing study packs. We made study packs of whatever was on the VLE, same as what the other students are going to get, made them into study packs. We transferred it to centers in Gilgit and Chitral, where our liaison person, as we speak, is downloading it and copying it into USBs. And these USBs will then be sent out to the villages, to these 60 students, where the riders will go and they will drop it at the address of the student. We know that these 60 students do have a laptop at home. So as soon as the USB reaches them, hopefully they should start to open the folders and start studying. With that, we also have facility that in case somebody's laptop doesn't work in their village, we will take out printouts of those study packs and give them hard copies through riders for them to enable them to study and appear for remote assessment, and the riders will be sent to their door again. When they have done the assessments, they will be picked up again, and then they will be sent to us one way or the other. And meanwhile, we are also looking at return to campus plan for these 60 students to start with, so that because they seem to be the most affected ones who do not have the access, and we are holding on to them. So if we are able to take the required permissions from the HEC, from our own leadership, and ensure safety measures in our in-campus hostel, they will be the first one to be asked to come back, so that the VLE study and the internet access could be made available to them, and they could start studying in the best possible manner. So that's our story from School of Nursing, our experiences, our learning areas. And with that, all I can say is let's keep calm and learn online.